Okay, thank you for taking my question. Can you hear me?
Very well. Please go ahead.
Okay, good afternoon. I have a question about the origin of the virus. We noticed that the last week before last week, Spanish researchers tested coronavirus in wastewater sample of March last year, after the Brazil experts announced the similar findings. So based on these findings, an Oxford expert pointed out that the coronavirus may have been lying dormant across the world until emerging under favorable conditions, so rather than originating in China. So I know we have asked such kind of questions before, but I wonder what's the new learning or understanding of WHO on this issue of wasted water? Thank you.
Certainly, surveillance of wastewater is a really good way at looking sometimes at the long-term epidemiology of any disease. We use surveys of wastewater, for example, to track poliovirus around the world, and it's a very effective way of knowing where a virus is and what circulating strains are. We've certainly seen the same for cholera and other diseases. So the environmental surveillance in general is a very, very useful way to supplement human surveillance when it comes to the understanding of disease. And we congratulate our scientific colleagues for using those methods and innovations to look at the potential that this disease was present earlier than may have been previously suspected. But when it comes to investigating human disease, and the Director General has spoken of this many times, you need to go to the epicenter and work from there. We're very, very clear. The first human cases of this disease were picked up in Wuhan, the first clusters of disease in Wuhan, China, and then subsequently spread from there. And that is where the starting point lies for a full understanding of the origins of this virus in the animal kingdom. And the animal source, or the intermediate hosts, have not been determined. We assume the primary host is a bat, but certainly that's also to be fully determined. But that is the source of the human cases, or the first evidence of human cases. The question remains then, what were the incident that allowed the transfer of that disease from animals to humans? Where did that occur? And that can occur in the area in which the first human cases are noticed, or can occur far away from there. We've certainly seen in Ebola and other diseases that the first human cases can be unnoticed, and then by the time you pick the disease up, it's already somewhere else. And that's been very often the case in Ebola. The first cases that are noticed are in health workers. Well, we don't assume that the bats came and bit health workers. What usually is the case is that there's a trail of cases going back over some time, and at some point historically there was a transfer of disease from the animals to humans. So it is a detective story in that regard, and you have to go where the data and the science leads. We keep saying we have to follow the science, and when it comes to understanding the origins of disease, you have to follow the science too. And it's really, really, really important that ultimately, and I'm sure our Chinese colleagues are doing this already, they have tremendous capacities for disease investigation and scientific understanding, that we start where the disease began in humans, or where the first cases of disease occurred in humans, and we work from there, and we keep an open mind. And it's really important that we keep an open mind. But you can't close your mind based on one or two other findings elsewhere. That becomes a distraction. And again, you end up being led down different alleyways that are not helpful. The data and the evidence should lead where it leads. And this investigation and understanding of how the disease transmitted and where and by what animal did this disease breach the barrier to humans needs to be understood. It's extremely important that it is understood. And that investigation and that scientific understanding should start at where the first clusters of human cases were detected, and that's in Wuhan in China. Maria?
Okay, thank you.
Oh.
Thank you.